The spine and joints are important components of the human motor system and participate in almost all activities. Thus, diseases and injuries in these areas lead to limitations in everyday life. Many complaints arise in a particular segment of the cervical, thoracic, or lumbar spine. In some cases, the pain radiates to the legs, arms, chest, or back of the head. Radiofrequency therapy with heat effect was introduced quite some time ago. This method is a standard procedure of special pain therapy in which the affected nerve structure is damaged with heat in order to reduce transmission of pain. However, this can lead to anesthesia and damage of the motor neurons. About 15 years ago, Swiss and Dutch pain therapists noticed that the temperature is probably not solely decisive for the thermal lesion, but that the electric field thus applied to the nerve influences the therapy mechanism positively and contributes to the effectiveness. With the stiff electrodes used in the past, it was not possible to reach the spinal canal, and it was very difficult to accurately locate the nerve pathways. With the old traditional method, it was necessary to locate each individual segment by means of a needle stick each and every time, which often proved to be uncomfortable and dangerous because of possible damage to vessels and neuron structures. Treatment is totally different with the multifunction electrode that has been developed for this purpose. It arose from the idea of performing physiologic pain therapy with pulse current and attempting to influence the connection pathways in the dorsal horn, where modulation of the pain transmission occurs. This method is not destructive and only produces modulation of the pain pathways. A high electric field is built up at the tip of the electrode. The current required for this is applied by means of a special generator in very short bursts of about 20 milliseconds, with a subsequent pause of about 480 milliseconds. This pause is necessary in order to dissipate the temperature generated at the electrode tip, which is applied to the affected nerve so that the highest temperature achieved is 42 degrees Celsius. Nevertheless, a very strong electric field is present. The affected nerve pathway is treated for about 4 minutes with the pulse current. The multifunction electrode is a specially developed flexible catheter with which the nerve structures are accurately located. Epidural bisensory test stimulations, then the pulse radiofrequency is applied. In addition, there are 2 poles at the distal end of the electrode. Between these 2 poles there is an opening for injection of medications in case of urgent need. The epidural pulse radiofrequency treatment with the multifunction electrode can be performed in one session, specifically formed from the cervical C2 through the thoracic segment, the entire lumbar segment, and also the sacral segment. All nerves treated with this method show no sensory deficits and no motor damages because they are not destroyed with heat as with the traditional method. The indication for the pulse radiofrequency treatment is comparable with those for the normal radiofrequency treatment and the spinal cord stimulation, namely primarily neurotic pain and the failed back surgery syndrome. In addition, the pulse radiofrequency is used for trigeminal neuralgia and other peripheral neuropathies. The electrode sheaths are provided with a camera protection, adapter cable for the generator, the electrode, one special introducer needle, the local anesthetic, and one needle for local anesthesia, one scalpel for skin incision, one 10 milliliter syringe and saline solution, medications to be injected if necessary. The manufacturer's statements about each medication must always be observed. The patient is placed flat prone position as comfortably as possible whereby the operator should have optimal fluoroscopic capabilities and be well able to access the treatment field of the spine under direct vision. The neutral electrode of the radiofrequency generator is taped to the patient's body, usually on the upper arm or the scapular area. The skin is disinfected over a wide area. The operative field is included in the fluoroscopic field, and the skin in the area for the electrode access is anesthetized. The patient is draped in a sterile manner. The sterile materials are prepared for the operation. This procedure is recommended because the local anesthesia can develop its full effect during this time. Initially, the operator uses a special puncture needle and possibly a scalpel. Special puncture needles with special shape that allow optimal puncture of the spinal canal and electrode placement that spare surrounding tissues have been developed for this procedure. Traditional needles can damage the electrode when it is being introduced and should not be used under any circumstances. A small incision with a scalpel can facilitate introduction through the skin. The puncture needle is introduced under fluoroscopic view, in this case contralaterally to the affected area, into the epidural space using the loss of resistance technique. The multifunctional electrode is unpacked after successful puncture. Only products made of soft materials with very flexible tip can be used. Electrodes and catheters with stiff tip can very easily injure the spinal cord. This can lead to major problems. The operator bends slightly the tip of the soft electrode to simplify steering in the spinal canal. The multifunction electrode is steered safely and reliably in the spinal canal by turning the stylet to the left or right. Now the electrode is introduced into the spinal canal through the puncture needle. The operator tries to direct the radiopack electrode tip under fluoroscopy to the nerve responsible for the pain signal. When the electrode has reached the target on the X-ray image, the proximity of the pole to the nerve is checked by using low voltage. The procedure for this is as follows. The electrode is connected to a special radiofrequency generator with integrated pulse mode. A sterile camera sleeve is used to protect the generator cable. The generator is turned on and a low voltage is brought to the tip of the electrode. The statements of the manufacturer must be strictly observed for all settings at radiofrequency generators. Low voltage of 0.3 volts to 0.8 volts and a frequency between 50 and 70 Hz are needed to test the electrode position. If the electrode position is adequate, the patient will feel a mild tingling sensation in the pain area during stimulation with these parameters. It is important that at least part of the pain area be affected by the stimulation. The high electric field that arises in this way causes chemical reactions in the nerve which reduce transmissions of pain. During the entire procedure, the operator or the medical team keep asking the patient about the spread of the stimulation and thus receive additional certainty that the active pole of the electrode tip is very close to the nerve pathway. Now the pulse mode is turned on at the generator and thus pulse current is released at the active electrode tip. This usually takes 240 milliseconds. All parameters are measured online and displayed at the generator. The application of this current is not felt by the patient. The temperature at the electrode tip rises to a maximum of 40 degrees Celsius during the entire operation, so that the tissue in the stimulation area is not injured. When the stimulation of the nerve has been performed, the operator locates the next affected nerve in order to repeat the procedure. Thus, several nerves can be treated in the same session, which is easier on the patient and saves time. If the operator wishes, it is also possible for anti-inflammatory medications to be injected exactly at the nerve. For this, the stylet is removed from the electrode and the filled syringe is connected to the Lure lock. The medication is released at the special opening between the poles of the electrode tip. When the operation is over, the electrode and the needle are removed together and the puncture site is cleaned and dressed. This method has been integrated as a standard into the currently practiced procedures in several pain centers.
Nach der Stimulation haben nur ca. 10% der Patienten eine deutliche Schmerzlinderung. Im Durchschnitt kann man die Methode erst nach 3 Wochen beurteilen.
It is assumed that during this time, chemical reactions which can inhibit or even eliminate the transmission of pain take place in the structure of the nerves and the posterior horn.
Nach 3 Wochen kann man eine Bilanz ziehen und nach 3 Wochen haben ca. 70% der Patienten eine deutliche Schmerzlinderung.
If the patient responds to this therapy, it can be assumed that pain relief will last up to 1 year or longer. Experience shows that this method is very efficient if the indication is clear. It is finding increasing acceptance due to the low risk and the low invasivity.